Hello, everyone. We are going to discuss breast examination. So, as you know, as any procedure, we're going to start by greeting the patient and introducing ourselves. So, hello, my name is Afaq. I'm one of the junior doctor here. Can I confirm your name and age, please? Thank you for confirming that. And now the next step, we're going to explain the procedure to the patient. After that, we're going to tell the patient the exposure. So for the purpose of this examination, you need to be exposed above waist. Is that okay by you? All right. I will ensure your privacy and I will have a chaperone with me throughout the examination. Is that all right with you? And then we're going to go for inspection. So in inspection, we have 5 steps. So first we'll ask the patient to put hands on the side and then on the hips and then hands above head. And number 4, we'll ask her to lift her breast. And number 5, we're going to ask her to squeeze the nipples. So I will go again into a little bit of depth. So we'll tell the patient, could you please sit straight and rest your hand on your thighs? So what we're going to do, we're going to look for any asymmetry, and obviously there is minor asymmetry in a healthy breast. But if it's like big discrepancy between the two breasts, it will be like maybe a tumor or any other pathology. And we're going to look for any superficial masses or skin changes and or any nipple changes, for example, retraction, discharge, nipple discharge, and also we're going to comment if there is any scars from previous surgery. So our comment will be like this. So on inspection, both breasts are symmetrical and their nipples are in the same levels. I cannot appreciate any redness or any nipple discharge, scars or swelling. And I can also, I cannot appreciate any obvious masses. And then we're going to ask the patient for the next step, which is, could you please put your hands on your hips and slightly bend forward like this, and you can demonstrate. And then you're going to comment, I can appreciate or I cannot appreciate, depends on what you're seeing, any masses or swelling on bending forward. And then the third steps, we're going to tell the patient, could you please place your hand behind your head like this and demonstrate again. All right. Okay. So what we're going, when the patient put her hands above her head, we're going to look for any supraclavicular and axillary lymph nodes. So I would say there is no any axillary or supraclavicular fullness. So just by inspection, we're going to do it in the examination again. And the next or number 4 steps, we're going to tell the patient, could you please, with the help of your 2 fingers, lift your breast up for me. And we're going to comment again, there is no eczema or fungal infection in the inframammary mammary region. I'm very bad in pronunciation. And this step number 5, could you please squeeze your nipples with your fingers? And we're going to comment again, I cannot appreciate any discharge or bleeding from the nipples. This is inspection done. The next step, as you know, is palpation. So the bed has to be in 45 degrees, which is been adjusted for you. You don't need to adjust it in the exam. You will find it already on at 45 degrees. So could you please lie down on the couch for me? I'm going to, you will inform the patient, I'm going to touch your breast now. I will be as gentle as possible. However, if at any point you felt any discomfort, or would you like me to stop the procedure at all, you would do straight away. And we're going to check by superficial palpation for temperature and tenderness. As you know, there is no any rise in the local temperature, and there is no tenderness on superficial palpation. And our third steps in the examination, which is deep palpation. So you will tell the patient, this time I'm going to touch you deeper, or I'm going to touch your breast deeper. Is that okay by you? So always take permission. Is that all right by you? Is that okay by you? All right. So, and as you know, we're going to palpate the 4 quadrants of the breast in addition to the axillary tail. So don't forget it as well. Is that clear so far? All right. So we nearly there. We did our deep palpation for the 4 quadrants, as I mentioned. If we find any lump, so as you know, we're going to comment on the site, size, shape, surface, consistency, margins attached to the overlying scales, and mobility, as well as tenderness. So for example, if you find a lump in the upper quadrant of the breast, you would say, in deep palpation, I can appreciate a mass which is located in the right upper quadrant of the right breast. So you need to specify where exactly, which quadrant and which breast, and it is mobile, and for example, about 2 by 2 centimeter in size, and it's not attached to the overlying skins or underlying structures. And that's it. It's easy peasy. And if you find a time, I think like sometimes they bring it combined station. It will be very difficult to manage your time. But if you have enough time, of course, we need to finish our examination by checking for axillary lymph node. So the patient has to be on the standing position. So you will tell the patient, I'm going to examine the nodes or the glands in your armpit. Can you please stand up for me? Yeah. And when you finish your examination, you will ask the patient to dress up and thank you the patient and explain your finding to the patient or examiner according to the task. And this is all about breast examination. I hope you find it useful. I'll see you next time. Thank you.